Language then? Do you want to go with English or do you want to go with Spanish?
Or maybe if you want to go to English, I mean, if you communicate within yourself in Spanish, it's okay.
Yes.
Maybe you communicate what you're saying.
Okay.
Just if you speak.
I think we can do it in English, but maybe we use some Spanish words in the meantime if we don't feel like coming out quickly.
Just speak out loud, not one on another.
Okay.
All right. I will give the stem. Do you want English and then Spanish or just English?
Just English, I think.
Just English.
Bueno, maybe for the first scenario, just to be really clear.
Okay, that's okay. We'll do that. This is a 5-year-old boy who has a chronic history of lupus, systemic lupus erythematosus. Okay?
Yes, fine.
Perfect. No, good. Vale.
He has been sick for the last 2 days. He has not been taking fluids very well. He has become puffy, puffy, edematous, right?
Yes.
And the mother has brought him into hospital today because he is confused. Mother says that she is worried because he has also been swollen, confused, and maybe breathing a little abnormally. Okay?
Okay.
Great.
Yeah.
Okay.
I think we are. Do we have any relatives here?
Yeah.
The mom is here. The patient is with us.
Yes.
This is my team. Team. Are we in a 30 or 11 hospital?
Yes, you are.
Okay, perfect. So let's do the first consultation.
Okay.
First of all, we protect ourselves.
Yes. Is he confused? Is he awake?
Yes, his eyes are open, but he's saying words that don't make sense,
Is he
confused.
confused? Okay.
Yeah.
And is he pale or the color is
He's
fine?
pale.
He's pale. Okay. And does he have any work of breathing?
He's breathing fast but shallow. He's not distressed, just shallow.
Okay, so we have an uncompensated sore.
Okay. So we are going to divide some rows. So you're going to stay inside of the airway, get an respiratory mask into the oxygen. Okay. Now that means you don't want to break the patient. You get an you will do an ACT evaluation.
I don't know, he's fine. What have the airway free? Is there any secretions?
No.
Okay.
Okay.
So we call it the respiratory mask.
Yeah, hydroxychloroquine. Hydroxychloroquine.
Okay. Something more?
No, just hydroxychloroquine.
Okay.
Yeah, he took it today.
Other things or only
No, just maybe.
He's pushes the mask away from his face.
maybe you can get some dyspnea for the
He's trying to take this out.
Yes, he's trying to take him
Do I have an IV access?
Yes.
We can try to calm him. It's okay.
With him, we find
Okay.
with him, okay?
Okay.
So the bilateral sounds are both sides good sounds, no crackles, no wheezing.
You listen to his chest. He does have crackles
Crackles
in both lungs.
sides. Okay. So bilateral crackles are 95 with a respiratory mask. Any retractions?
Mild
Mild
retraction.
retractions?
I'm taking a capillary glycemia. What's the number?
Yes. It moving. So you just when you look at him, he does have his swelling. He's swollen around his eyes and around his hands and his feet. He looks quite swollen.
Okay. Okay. Heart rate is 120 in 6 years heartbeat. The person is we have capillary refill. It's
3 seconds.
3 seconds. Okay. I feel peripheral pulse.
Okay. Do you achieve to get some samples for
Yes,
them?
I
kept them. So
Yeah.
what are the glycemia? Do you have them?
He'll be back in 20 seconds.
Yeah, okay, great. So it should be blood biochemistry, CBC, and another for the photos, because maybe it's
So he's sleepy, still confused.
His eyes are open and he's looking around, but he's not really focusing.
Yeah.
Okay. And the pupils are normal.
Pupils are free and reactive.
Symmetrical.
Symmetrical.
Okay. Anything on the skin? Any rash? Any other reasons?
No rush.
No rash. Okay. And temperature?
Glucose is normal.
okay.
Temperature is there.
Okay, so with this patient, for the evaluation is a decompensated shock with this condition, lupus with swelling all around. It is a complication related with the kidneys and with the infection with the lupus. And we can take 1 minute to speak with Angela because she has been speaking with the mom. Something important?
And he takes hydroxychloroquine, but he has administered syndrome usually.
Okay, okay. Yeah, that is about it. We should prepare 2 per kilo, prednisolone.
2 days.
Maybe we are thinking that it could be something related with the kidneys and
Your labs are back.
kidney failure.
Yes, okay.
Maybe we want to see the electrolytes.
Yeah. We're going to do an evaluation so we can check the respiratory.
So airway is still free, any secretion or anything?
No secretions.
Okay, we give the respiratory mass, the salts are 96. Maybe we can sit up a little bit because he will be more comfortable sitting up. Okay, so he can breathe better. Okay, still bilateral brackets.
Yeah.
When you have him sitting up, he's looking dizzy.
This here.
Okay.
So maybe we put him back in.
Okay.
He was feeling better like that.
Okay. The other about the airway is the neurologic dysfunction is getting worse. Maybe he will need the paralysis here. So we can
Here. We can right.
Yeah.
Yeah.
Have the okay, maybe we can, are you on B?
B still brackets.
Yeah.
And salts are fine.
Yes. We can try the fluorescence, but I'm doubting because maybe the patient hasn't been taking fluids for the few days, so
Yes.
maybe it shouldn't be like very good for the
blood pressure is a bit low.
It's not good, so we will wait for that.
Maybe we can put some fluids.
Low dose, yes. Okay. 5 miles per kilo. Fluids slowly, okay? Okay. Okay. Also, prepare antibiotics. And then we have the
I feel the belly. Do I feel any hepatomegaly or anything?
1 centimeter.
1 centimeter. Okay. And it's not distending or anything. No.
Okay. And lastly, maybe we can administer the saline fluids because the sodium is 130. Okay, so it's for sodium fluids. Okay,
But that's not
it's normal. Yes, it's 5. For the rest, they are okay. Okay. Well, the creatinine is high, so even if it was kidney failure, yes. Okay.
capillary refill is the same. Okay, prolong. Do I still feel
Try to get another idea.
It's weak. Pulses are weak.
is weak? Okay. Ventricular pulse. The blood pressure is low.
We can anticipate, so maybe for this patient, first we're going to take 2 IV acids, we're going to administer fluids, we are going to just prepare the adrenaline, okay, have it there, okay, and the advanced management of the airway, okay?
Yeah. Okay. So the tachycardic, low blood pressure, capillary refill.
Yeah.
And is he still confused?
It's still the same, yes. In fact, his eyes are closing, but he does open up his eyes and look around, and then he closes his eyes.
Do I have a second IV line?
Yes.
Okay.
Yeah.
Laura, if you're free, can you prepare for vaccine?
Okay, first, I'm checking, the calcium is a bit high, okay, it's 1.8, so increasing 1.75 is high. This is millimole per liter?
Yeah.
I guess.
Upper limit is 1.4. It's high.
It's high. Okay, great. So the treatment is the fluids, so we are just administrating. Okay, so also the furosemide and the corticoid. So we just administrate the three treatments for that. Okay.
Okay.
But we should call the authorities, so maybe they can give us some suggestions about any other treatments for this patient because it's like a specific condition. Continue.
Yes, okay.
Yeah. Also ICU. Yeah, if you're free, you can talk
Yes.
both of them.
Infusing ciprofloxacin, metropolis, Angela. Infusing cardamom.
We will check how is the personal patients and then can demonstrate a second one just like my okay? So just prepare the second one. Okay, perfect.
Okay, so airway is still okay. Yes, airway is opening up, so he's breathing properly.
No, what do you need me to do? Just to know the patient is here and if you came to help us.
You can administer before the corticoid.
Maybe we can also use some
On the when you call the ICU, we just explain that we will need non-invasive ventilation for the helping for the edema. Okay.
For the program.
Okay.
You want me to
call? Yes, please. Thank you.
So
I have to call the ICU.
heart rate is 140. It seems hungry. Still low heart rate.
Yes.
Okay, yeah. We can check.
Okay. Now, no, I'm not done yet.
Not yet.
Someone has to give a handover to intensive care.
Sorry.
Hi, I'm the ICU doctor.
Hello, this is Amalia. I'm calling you for the emergency room. I'm attending a 5 years old kid suffering lupus previously that came with a decompensated shock. We are suspecting a kidney failure.
Okay, why is he in shock?
Why is he in shock? There's circulation saturated with prolonged capillary field, hypotension, and tachycardia.
Okay, so he has shock.
Yeah.
Why does he have shock?
It related with the kidney failure.
Okay.
Yeah, with the liquids, his
Okay.
hypovolemic because the liquids are he's very swelling and
Okay.
yeah.
Hypovolemic shock.
Yeah.
So what have you given?
We have administrated one corticoid dose, 2 milligrams per kilo, one isotonic fluids bolus, 10 miles per kilo, and the ciprofloxacin I guess is also just one dose because this patient has low fever also.
Okay, thank you. And what do you recommend that I do?
I think that you should continue with the management of fluids, maybe giving some diuretics to help the patient and also the fluids, like the management, and respiratory non-invasive support could help with the edema.
Okay.
Yeah, and
Maybe
the
it's possible he will need some dialysis because the management of
for the kidney.
electrolytes because it also he have a high calcium and he's very swollen, so it's hypovolemic, but not work so maybe he will need that.
Okay, thank you very much.
In Italian.
Generally, I speak in English and they speak in Italian among them.
Okay, so Lorenzo's going to be here and he's going to translate so that at least I, Craig and Lindsay, we're going to be able to hear what the team is talking about. I will give Stan the beginning of the scenario in English. Does the rest of the team want to hear translated into something?
No, it's okay in English. Only they speak among them in Italian.
Okay.
Can I just one question? I have to say the sign of the for the cover.
Try. It's still being taped.
Okay, I will try. Okay.
Okay. Right? Have fun. right?
Yes, we will.
So it's not possible to use that as a full.
Stool in case no.
Because we got this. Yeah.
No, okay.
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 We get 1 minute.
Okay. So this is a 5-year-old boy with lupus, systemic lupus erythematosus.
Okay.
He has been sick for 2 days.
Yeah.
He hasn't been peeing, hasn't been urinating. He has not been taking much fluid by mouth either.
Okay.
He has, over the last 2 days, become more edematous. His eyes, his hands,
Okay.
his feet.
Okay.
His mother brought him into your emergency room this morning because she was worried that he seems to be confused. He's saying things that don't make sense.
Okay.
Okay? And he also seems to be breathing a little faster than is normal for him. So she was worried about those 2 things. And she was just brought him in. Here he is.
Okay, here it is. We have already had our roles. Laurie, you are the monitor. Sylvie, you are the airways. David with the circulation, and Martin, you have me with the drugs and the thanksgiving and currency if they are wrong. Okay. What about the consciousness? Is he awake?
So when all of you are around, his eyes are open. He's looking at you, and he's trying to talk, but some of the words are
Okay. What about the breathing? Can we see here? Okay.
His breathing is a little fast, but it's shallow fast.
Okay. What about the skin? Can we see if the skin is okay?
Skin is pale.
It's pale. Okay. So we have a stable. We put all the vitals on, tending them. It's an stable patient. So we get the oxygen and our breathing rate 100%, and we also start searching for 99. Okay, we can put all the vitals on, and in the meanwhile.
EKG monitoring, pulse oximeter, and ultrasound.
Very good. And in the meanwhile, we can start the evaluation.
Okay. The airways are patient and stable. The airways are patient and
Yes.
there are any object or secretion?
No secretion.
The saturation of the machine. I listen to the lung.
When you are listening to the lungs, you hear a lot of crepitations through both lungs. That's what the lungs sound like.
Okay, we have to consider that the crackles, the crepitation can be both signs of respiratory and cardiac problem.
Yes.
Okay, so we can respond the evaluation. Please.
Yes, I check for the peripheral pulses. Are they weak?
The center, so they are weak.
Oh,
They're
okay.
there, but they are
Yes,
weak.
but they're very weak. Okay, refill time.
It's about 2 seconds.
2 seconds, yes. Also the signs of fluid overload, like liver and...
His liver is down 1 centimeter below the ribs. When you look at him, he has a lot of swelling around his eyes. And he has, his hands are swollen and his feet are swollen.
Yes, okay, so also... Yes, and also the glycemia, we keep the glycemia.
Did we manage to take the hidden lines?
Yes.
Okay, so we can send the exam, please. Alexometry, we send our routine with the liver and renal exams, and also hold the electrolytes, please. And then I think we can start maybe 37.8, okay, we have a temperature of 37.8, okay, so we can also send a blood culture. What do you think about it? Ok, lui ha 5 anni, quindi stimato 20 kg, facciamo, ok, in realtà 5 anni, 90-60 siamo ancora buoni, ma forse un pochino deboli, quindi forse, considerando, considerando che i feriti potrebbero essere, possiamo dire, sia una temperatura alta e quindi un quadro di shock septico, così come un quadro comunque di coinvolgimento cardiaco per il discorso dei ranchini, quindi Io partirei forse con un volo lento e allo stesso tempo cercherei un secondo accesso, in order to considering doing the antibiotics. Okay? So we start a bolus, okay, in volo lento, we say 10 kilos in 20 minutes with a middle time evaluation. And in the meanwhile, can you search for a second EV line? And we go on with the evaluation.
Yes, we have of course also
Which end?
Okay, we are doing 20 milliliters in 20 minutes with a middle evaluation.
I'm sorry, how
How
much?
much?
10 per kilo, which is
Grazie.
Did I manage to take the second access?
Yes.
Okay.
we ask also for glycemia.
Glycemia, POCT.
Okay. Yeah, pupils.
We're 3 and reactive.
Okay. Okay. And we see also for the same meninge.
Just one.
Normal.
Normal. Okay. Yes, I'm conscious. He's still like
The same.
wondering. It's the same. Okay.
Okay. We have the second access, so I think we can start Ceftriaxone.
Yes.
We think about it. Okay, we can do
Ceftriaxone bolus, 100 milligrams per kilo, so 15 kilos, so 1.5. 2 grams. 2 grams in bolus.
Yes. In the skin, do we see something? No.
Just swelling.
Yeah.
Okay.
These are the second patient, so we can put also a folate on and send for urinocultura and also a cholesterol, even though the symptoms are okay. And then, maybe, I will put the folate on. Perfect. So maybe you can go searching for a.
Don't get any urine. No urine.
No urine.
No urine. Ok. D'accordo, va bene. Ti vai a parlare con il genitore. E intanto noi facciamo un attimo il punto della situazione. Vogliamo chiamare dei consulenti?
And your lab suffers often. Your what happened?
Si è stata aggiornata.
Siamo stati aggiornando, abbiamo fatto un primo volo, abbiamo fatto il secondo volo. Well, we have seen the pressure is going down, so we have done the first ball, I think it's finished. Okay, so we can, yes, before we check for the which are the pro signs. Are they okay? This is not
The
a...
capital is 3 centimeters.
3 centimeters.
Okay.
Now it's 3.
Now it's 3, so we have to think about a cardiac component and ask for ultrasonography in order to see the heart. Is it available?
It is.
Okay, so maybe you can do this. What? Okay. Okay, for something.
There is a large effusion surrounding the heart.
Large
It's
effusion.
about 3 centimeters in all around the heart.
Okay. The pressure is getting it o non lo vediamo? Ok, perché noi possiamo pensare che il quadro che abbiamo controlliamo anche se non abbiamo il della differenziale, però dobbiamo chiamare il cardiologo e l'anestesista. Ok?
Sorry, can you repeat that last
Yeah,
thing?
sorry. Okay, considering the echographic scenario, okay, we have to think about tamponade. Okay, we were watching to the pressure in order to see if there is an increase. That is not, but we are during the second. I don't know if we have said it, but we are thinking about the second bolus, and also I think we can also start so that we have a HB line disponibile, okay, available to do an amine continuous and epinephrine. Okay? And epinephrine at the first line, 0.05 micrograms per kilominute, and then a second chance, if it doesn't work, we can consider rinone. Okay? And we have called the anesthesiologist and the cardiologist.
Can we call them?
We didn't call them. Okay.
So I just want to say
Sì,
that is a baby with diabetes. It is oxychloroquine. Is that really sick?
Okay.
It told me you avete visto che ha un problema con
un tamponamento, sì.
allora trattiamo
il cardiologo
Ok.
We have not seen yet the
non lo ricordo.
What about the pH?
7.2.
Okay, il calcio is and which because yesterday you gave us a calcium which we thought it was
So the upper limit is 1.4.
sì, no, che cosa scusami?
Il limite superiore è 1.4, questo è 1.8.
Il calcio
è
So we have seen the exam. I think we can consider correcting the hypercalcemia.
Okay, quindi what about some frozen because it's swollen. He has a lot of fluid around his heart. The calcium is elevated, and some frozen will lower the overload fluid. In the meantime, you can go with some other fluids. Okay, to get the circulation.
Okay. We didn't stop the okay, so yeah, I agree. Okay, so we start live.
And now, ICU.
ICU, okay.
Hand over to ICU.
Hi, I'm the ICU. What do you need?
Hi. Okay. I have a 5-year-old guy, 20 kilos of weight. He arrives with lupus. He has accompanied in a decompensated cardiac shock with fever. So we also did a check-check-son. We have already done a bolus, 10 milliliters per kilo. We have after that hit. Posso farlo? Posso continuare in italiano?
Tranquillamente.
Grazie. Dopo di questo sono peggiorati i segni di sovraccarico, quindi adesso stiamo valutando sulla base della sua clinica di iniziare un diuretico e di pari passo proseguire con dei fluidi. Proseguire con dei fluidi molto lentamente e avviare un'epinefrina, un'adrenalina in continuo a 0,05 mg kilo.
Sorry, what kind of shock did you say you have? I'm confused.
Obstructive shock, uncompensated, because well, the saturation is good. We are supporting him with another person.
Okay, what do you recommend I do? Sorry.
In order to continue supporting the circulation and also the ventilation.
What do you want me to do?
Okay, to continue do another bolus slowly. Start Arasix, we were talking about. Start an amino continuous, so and about the support of the ventilation, it depends on dipende dall'andamento quindi se degenera bisogna considerare una necessità di un supporto avanzato, quindi un'intubazione possiamo preparare il materiale 5 anni.
Okay, I'll be down in a minute to help.